Welcome to ClearPath NCLEX, your clear path to nursing success.
Things first, what are we even talking about? Well, IV fluids are basically these specially designed liquids that we, as nurses, infuse into a patient's vein. They're a super important tool for managing a patient's fluid levels and keeping their electrolytes, things like sodium and potassium, in balance. Now, to really understand how these fluids do their job, we have to back up a little and talk about where fluid actually lives inside the body. Think of it like the body has different neighborhoods for water.
The two main neighborhoods are intracellular, which means all the fluid inside your cells, and extracellular, which is all the fluid outside your cells. Now, that extracellular fluid is broken down even more into what's in your blood vessels. We call that the intravascular space, and what's just kind of floating around in the tissues between your cells. Our main job as nurses is to keep the peace and balance between all these neighborhoods. So here's where it gets really cool. Fluid is constantly moving between these compartments. We call this fluid shift. And what drives this movement? It all comes down to one simple rule. Water follows solutes. Solutes are just particles like salt and sugar. So water will always move from a less concentrated area to a more concentrated area to try and even things out. If you can remember that one thing, water follows salt, you're going to understand everything that comes next.
All right, let's get into the three main tools in your IV fluid toolkit: isotonic, hypotonic, and hypertonic solutions. Knowing these inside and out is absolutely essential for the NCLEX. First up, we have isotonic fluids. The little phrase I want you to remember is, isotonic stays where I put it. See, these fluids have about the same concentration of particles as our own body fluids, so they're perfectly happy to just hang out where we infuse them. The two big ones you're going to see all the time are 0.9% normal saline, or NS, and lactated ringers, also known as LR. These are your go-to fluids for a lot of common situations.
And here's the key takeaway. Because the concentration is the same as our blood, there's no major shift of fluid. The fluid we give simply stays in the blood vessels and boosts the volume right there.
This makes them perfect when you need to increase a patient's blood volume fast, like if they're in shock or really dehydrated. But because you're adding all this volume, you have to be on the lookout for fluid overload. That means listening for crackles in the lungs and checking for swelling.
Okay, next up are hypotonic fluids. The memory trick here is that fluid goes out of the vessel. It moves into the cells, making them swell up like a big fat hippo. That's because these solutions are less concentrated or more watery than our blood.
You'll see things like half-normal saline, and then there's a really sneaky one you have to know for the NCLEX, D5W. Now listen close. D5W actually starts out isotonic in the bag, but once you infuse it, the body eats up that sugar, the dextrose, like right away. And what's left behind? Just water. So it acts as a hypotonic solution inside the body. That's a huge test. So because these solutions are more dilute, water gets pulled out of the blood vessels and rushes into the body's cells to try and balance everything out. This is how we hydrate the cells themselves. This is awesome for treating things like hypernatremia, where high sodium levels have pulled water out of the cells. But, and this is a critical safety alert, you must never ever give hypotonic fluids to a patient with a head injury and increased intracranial pressure. It'll cause those already swollen brain cells to swell even more, and that can be fatal.
All right, last but not least, we have hypertonic fluids. These are the complete opposite. Here, the fluid enters the vessel from the cells. These solutions are super concentrated, way more than our blood.
You're going to see these mostly in critical care settings. We're talking about things like 3% saline, or D5NS, where we've added dextrose to a normal saline solution, making the whole thing hypertonic.
These super concentrated fluids act like a magnet for water. They literally pull fluid out of swollen cells and tissues and suck it back into the bloodstream. This makes the cells shrink.
So, while these are lifesavers for conditions like cerebral edema or brain swelling, they're also really high risk. They can throw a patient into fluid overload in a heartbeat. That's why they have to be given very slowly, and the patient needs intense monitoring, usually in an ICU.
Okay, so it doesn't matter which one of these fluids is hanging, your nursing assessments are your patient's #1 safety net. Let's quickly go over what you have to be watching for. You have to be on top of your game. You're monitoring their intake and output, you're getting a daily weight at the same time every day, you're listening to their lungs, checking their blood pressure, and always checking that IV site. These are your earliest clues that something might be going wrong.
All right, now for the part I know you've been waiting for, how the NCLEX is going to try and trip you up on this, and the easy memory tricks to make sure you don't fall for it.
Be ready for questions that hit these 4 points. First, they love to ask about that tricky D5W. Second, you will absolutely be tested on not giving hypotonic fluids to head trauma patients. Third, remember hypertonic fluids are an ICU-level intervention. And fourth, if your patient is in hypovolemic shock, you're reaching for isotonic fluids first to fill up that tank.
To make this stick when you're under pressure, just burn these into your brain. Isotonic stays in the vessel. Hypotonic makes cells swell up like a hippo. And hypertonic makes the fluid enter the vessel, making cells skinny. It's simple, but trust me, it works.
Okay, you've done the work, you've got the knowledge. Let's put it to the test with an NCLEX-style question. You ready?
Okay, read the question really carefully. The key phrase here is, should the nurse question? That means you're looking for the one order that is wrong, the one that could actually harm this patient. Take a second and think it through.
If you picked C, 0.45% normal saline, you are 100% correct. Fantastic job.
So let's break down exactly why. 0.45% normal saline, as we just learned, is a hypotonic fluid. That means it's going to cause fluid to shift out of the bloodstream and right into the brain cells. For a patient who already has a swollen brain and high pressure in their skull, that is an absolute disaster. This is one of those critical safety concepts you'll carry with you for your entire career.
And just like that, you have a solid handle on one of the most important NCLEX topics. If you found this helpful, please like, share, and subscribe to ClearPath NCLEX for more high-yield nursing content to help you pass that exam.